for joining today's webinar. My name is Dr. Marie DePirio, and I am a Senior Medical Advisor and Infectious Disease Physician at the National Institute for Occupational Safety and Health, or NIOSH, at the Centers for Disease Control and Prevention, or CDC. The title of our webinar today is Respiratory Protection Resources in Long-Term Care, and we will be featuring 3 great speakers. There have been many clusters of 2019 coronavirus disease, or COVID-19, that have affected both residents and healthcare personnel in long-term care facilities nationwide. The COVID-19 pandemic has presented unique challenges to our healthcare systems, especially long-term care facilities. One challenge that we've been hearing about regarding infection prevention and control measures is the implementation of respiratory protection programs in long-term care. Prior to this pandemic, the majority of nursing homes in this country did not care for residents for whom wearing a respirator was necessary. Therefore, we have developed this training webinar for nursing home administrators on how to implement a respiratory protection program in their facilities. I'm now going to introduce all 3 speakers so we can have smooth transitions between each of their parts. Our first speaker will be Tim Gackel, who will give a presentation entitled Managing an Effective Respiratory Protection Program. Tim is a certified industrial hygienist working as a safety and health instructor with the Occupational Safety and Health Administration, or OSHA, Training Institute in Arlington Heights, Illinois, since 2006. Previously, Tim worked for the Department of the Navy and for the Department of Veteran Affairs, where he managed a large hospital respiratory protection program. Currently, Tim is involved in instruction and development of a variety of health and safety courses and participates in outreach training opportunities frequently. Our second speaker today will be Dr. Bonnie Rogers, who will give a presentation entitled Competencies for Respiratory Protection for Healthcare Workers. Bonnie is a professor in environmental sciences and engineering, public health, and nursing at the North Carolina Occupational Safety and Health Education and Research Center, University of North Carolina School of Public Health. She is certified in occupational health nursing, case management, and as a legal nurse consultant. In addition to managerial consultant and educator researcher positions, Dr. Rogers has also practiced for many years as a public health nurse, occupational health nurse, and occupational health nurse practitioner. Our third speaker today will be Lieutenant Commander Megan Casey, who will give a presentation entitled Respiratory Protection Resources. Megan is a nurse epidemiologist and team lead at CDC NIOSH's National Personal Protective Technology Laboratory. She coordinates research related to the healthcare and social assistance industry sector at NIOSH. Megan also facilitates the National Occupational Research Agenda, or NORA, bringing together stakeholders to identify the most important occupational health and safety research questions facing healthcare personnel. So now I'm going to turn it over to Tim Gackel, our first speaker, to get us started.
Thank you, Marie. All right, so as the title says, I'm going to focus on explaining the management of an effective respiratory protection program. Next slide, please. All right, just so you understand what we're talking about today, we set our objectives to define what the term respirator means. This can be confusing to the general public and others, even in healthcare. So we're going to talk about the definitions associated with the term respirator. We're going to talk about the hierarchy of controls that OSHA uses in their standards to facilitate engineering and administrative work practices prior to using personal protective equipment, including respirators. We'll talk about hazard assessment criteria, but largely we're going to focus on the last 2 elements that you see here on the slide, and that is how to choose a respirator program administrator and how to effectively manage the program with that administrator in place. Next slide, please. All right, so it seems maybe like a very simple question to ask, but as I said, this can be confusing to some people. So what is a respirator? A respirator, according to OSHA, in its Small Entity Compliance Guide from 2011, says that respirators are devices that protect employees from inhaling harmful substances, including chemical, biological, and radiological agents. Now, this small entity compliance guide is an excellent resource for prospective respirator program administrators. It contains many illustrations, discussion points in a plain language format, including a question and answer, and even a sample program that can be adapted to specific work sites. I personally use this document very frequently as a trainer on respiratory protection to try and stay sharp with my own skills and knowledge. It's a great tool, and I'll likely be referring to it today a few times. Next slide, please. All right, the next definition we look at is what is called or known as a filtering facepiece respirator, abbreviated as FFR, and in parentheses, dust mask. So these are equivalent terms in OSHA's respiratory protection standard. A filtering facepiece is a dust mask. All right, and what it means is it's a negative pressure particulate respirator where the filter is integral or composes the entire facepiece. And for the acronym FFR, filtering facepiece respirator, this is something that we want to use primarily to help designate the style of mask that we're using. I want you to note that the term N95, the designation N95, applies to the filter material efficiency, which means it's 95% efficient at filtering particles of a designated size. So in reality, an N95 filter may be used as a part or a canister. N95 filter may be part of another style of respirator. For our purposes today, we'll try to be clear that when we're talking about the type shown in these pictures, it is best referred to as an N95 filtering facepiece respirator, or FFR, and these respirators are tight fitting. Next slide, please. All right, some other tight fitting styles of respirator include elastomeric facepieces, and these are simply facepieces that are made of flexible materials such as butyl rubber or natural rubber, neoprene, and other man-made plastics. And usually they include air purifying elements that can be replaced, including there may be N95 filters that are contained within a shell or adapted to attach to the facepiece. So an N95 filter can also be used on this style of respirator. The picture on the right is a half face, or maybe some of you know it to be called a half mask style respirator. And when it's equipped with N95 filters and used properly, it offers the equivalent protection as the N95 filtering facepiece respirator that we showed previously. The other picture in the middle is a full face respirator design, and it may offer higher protection to users when equipped and used properly. One advantage of these two styles is that they are designed to be cleanable and reusable, which can help with conservation of supplies of disposable style respirators such as the N95 FFR. One of the drawbacks is that these style of masks are heavier in weight, and that can be less comfortable to wear for long periods of time. Next slide, please. All right, another style of respiratory protection that is available and used in healthcare settings on occasion are powered air purifying respirators, or PAPR. And this is an air purifying respirator that uses a powered blower to force contaminated or ambient air through an air purifying element and provides that cleaned air to the inside of the either tight-fitting or loose-fitting style hood or mask. These style of respirators have a higher front-end cost, and they do have significant training and maintenance requirements, but the benefit is they do offer higher protection when they're used properly, and loose hood styles tend to be more comfortable due to the free airflow inside the hood or helmet. Next slide, please. There's other equipment that will be mentioned throughout this. Other equipment that will be mentioned throughout this broadcast. One of the things we want to talk to you about is surgical masks. So a standard surgical mask are for droplet fluid protection of the wearer, and they also keep the mask wearer's droplets contained and away from patients. Ordinary surgical masks are not respirators and are not designed to protect the wearer against very small inhalable particles. Surgical masks are loose fitting. There are, however, a style of PPE known as surgical respirators, which are tight fitting and carry a dual purpose and a dual approval. So they are FDA approved for the fluid and droplet protection, and they are also NIOSH certified as a respiratory protection device. Another type of equipment that is being talked about in many circles is face coverings. Face coverings are OSHA's term for cloth and homemade style masks that cover the nose and mouth. They are generally loose fitting. They may be somewhat effective at containing the wearer's droplets and secretions. Thus, they are recommended by some public health agencies to lessen the spread of disease. However, they are not surgical grade masks, nor are they respiratory protection. So OSHA recently published a frequently asked question on face coverings, and it describes some of these factors about face coverings in more detail. That's available on our public website, www.osha.gov. Next slide, please. All right, here's a question that when I train, I like to usually ask, and may come across as a little bit odd, but if an employer were to ask the simple question or tell an OSHA inspector or tell a safety person who's inquiring, I provide respirators to my employees, therefore they're fully protected. That may or may not be the truth of the matter. So what I want to get across here is that it's not necessarily a simple matter of handing out a respirator, but that OSHA has a hierarchy of controls that employers need to follow, as we'll see. Next slide, please. All right, so this is from our Respiratory Protection e-tool available at the same public site. And what it says here to get things rolling is that OSHA sees the use of respirators as the least satisfactory method to protect workers against hazards. And that the best choice would be to try and eliminate the hazard to the extent possible prior to having to use respiratory protection. So engineering and work practice controls are regarded as the most effective ways to prevent hazards from affecting workers. And that using respirators is not as satisfactory because of some of these reasons. Primarily, respirators are only going to provide protection if employers ensure on a constant basis that they're properly fitted and worn. So simply handing them out and issuing them is not the only step required. They need to be properly fitted, properly worn. I don't want to go through all of this, but certainly there are cost factors to be considered. And when you ask an employee to put on a respirator, they can be very uncomfortable to wear, especially for long periods of time. They could interfere with speech. They can sometimes interfere with work tasks. So we'll talk about how to get around some of those things as we talk about setting up a respiratory protection program. Next slide, please. All right, this slide maybe is one of the most important points that I would like to get across today, and that is that a respirator is only protective based on the features of the respirator that are designed to stop a hazard, in this case a respiratory particle, from reaching our mouth, nose, lungs, etc. So the features of a tight-fitting respirator that is an air-purifying style, and this includes our N95 filtering face pieces. The features include an effective seal to prevent inward leakage of ambient or contaminated air. In other words, leaking around the sides of the respirator, through the nose bridge, under the chin, and so forth. So an effective seal is one of the features that protects employees. The second feature is the purifying element itself. If we're talking about the N95 filtering face pieces, that whole face piece is composed of the filter, and that filter needs to stay as clean as possible, not be damaged, and the whole mask needs to fit tightly. So those first two things are really key to providing respiratory protection. And then the third bullet is really the third step, and that is to maintain a continuing effective respiratory protection program with all of the applicable elements. And what this kind of a catch-all third requirement means is that it's not a set and forget kind of a approach to respiratory protection. This does involve day-to-day inspections, discussions with employees and so forth, and observations of the equipment, whether it's being maintained and cared for and so forth. So if some of those things are not being accomplished, that can lead to a poor effect on one of those first two elements. Improper maintenance, for instance, can lead to overuse of the filtering face piece respirator. It can get dirty and may not purify the air as well as a clean and well-fitted respirator. And there are other things that can interfere with good use of a respirator. So a continuing program and management is very important. So I hope you take that to heart today. All right, next slide, please. All right, so the meat of what we're trying to get to today is, where do I start when I think about getting respiratory protection program underway? It's really about three things to do, and this is number one, to do a hazard assessment of the hazards in your workplace. Number two, determine the type of respiratory hazard in which you're going to potentially need to use respirators. Now with the national pandemic emergency that we have, this is pretty much decided for us, right? If we're talking today about protecting against viruses and using a respirator to protect against those biological aspects, that hazard assessment essentially has been partly done. And then the third thing we need to do is document the workplace and user factors that can affect respirator use. And this would be, examples of this would be things like an employee, a respirator user who has facial hair that interferes with that tight fitting seal around the face, because that's an interference to that protective feature of the respirator. Another example, which commonly happens in hospitals and in other industries, is that use of multiple types of PPE may have a conflict with a particular type of respirator being used. things like a respirator being used with safety glasses or goggles, and either the goggles not sitting properly on the face, or the respirator not being fit properly, getting interference from the goggles or the eyewear. So there are actually quite a few examples of user factors that can affect respirator use. So those kinds of things have to be taken into account. Next slide, please. All right, so let's talk a little bit about OSHA's Respiratory Protection Standard. Section C is the primary section that talks about the implementation of a respiratory protection program at a given facility. So what OSHA says on this regard is that when respirators are necessary to protect the health of employees or required by the employer, then the employer must develop a written program with worksite specific procedures. And the employee needs to not only develop this, but then implement it. Next slide, please. All right, within that section C of the standard, once a written program is developed, it needs to include all of the elements listed here if they are applicable. So proper selection, medical evaluation for the employees that are going to be expected to wear a respirator, fit testing of the tight fitting style respirators, and so on. Use, maintenance, and care. Training is very important as well. And then periodic or ongoing program evaluation, as well as record keeping. So when I spoke earlier about not just handing a respirator to an employee and expecting it to be protective, this is really what OSHA sees as the most effective way to ensure employees are protected while using respirators, to make sure all of these factors are taken into account. And some of these factors require some special attention, as we'll discuss shortly. Next slide, please. All right, the first thing required in a written program is that the employer must designate a program administrator who's qualified by appropriate training or experience to administer or oversee the program and conduct the required program evaluations. So for facilities that have never started a program, this may feel quite intimidating, and it's very understandable to continue to ask, where do I start? How do I do this? So today's focus, we're really trying to encourage you to help you understand how to go about getting started, and providing you a number of resources to accomplish the program implementation. It's not necessarily easy, but it's not necessarily difficult either. Its complexity is going to determine some of the things that you may or may not encounter. So we'll talk about that as we go. Next slide. All right, so when you have a program administrator designated, one of the duties, or one of the first primary duties, is to conduct evaluations of the workplace. And we use the term as necessary, and that implies ongoing and continual communication. And again, that is to ensure the effective implementation of a respiratory protection program. Next slide. Some of those factors that the program manager is going to be tasked with is to look at respirator fit in the workplace, make sure that the respirators that were chosen are fitting effectively, that they were selected properly for the task and given those user factors that I mentioned. And then ongoing insurance that they're being properly used, properly maintained, supplies are available, and so forth. So these are administrative types of duties that the program administrator will be responsible for. Not all of them are listed here, but these are some of the primary ones. Next slide. All right, another duty of the program administrator is to regularly consult the employees and to get a feel for how they view the program and is it effective. In this current climate and this current national emergency, there are no doubt people who are very concerned about their health. They're very concerned about their protection and being asked to work in an environment that is stressful and difficult, and asking them to put a respirator on their face kind of just adds to that intimidation factor, or that feeling of safety or being unsafe. So talking things out, communicating with the employees and assessing their views on how well the program is working not only works well with just good practice with your employees and communication, but also the employees, since they're the ones wearing the respirator, they can help in identifying and correcting problems, because the people doing the work are the ones that are going to have to wear it. They're going to have lots to say about any problems they're having with their respiratory protection equipment. Next slide, please. All right, so as part of where to get started, there is another tool that we highly recommend, and this is known as the Hospital Respiratory Protection Program Toolkit. And this was co-authored by OSHA and the CDC NIOSH in 2015, and it's geared more toward the medical or healthcare style of work setting. And it contains criteria for selection of a program administrator, has some discussions on that, what makes up a good program administrator. And it also has a sample template in Appendix D of this publication, which can be adapted as well for site-specific programs. The document itself is full of information, and therefore it is a fairly large document, but it is easy to read. It is user-friendly, has a lot of great tips and resources for starting a program. So you see in the hyperlink there, I've put that there. I highly recommend that once an administrator is picked for your respiratory protection program, that they get familiar with this publication, as well as possibly the small entity guide that I mentioned earlier. Two great tools to use. Next slide. All right, so what are some of the things that will be helpful in choosing a prospective respiratory protection program administrator? And these are not hard and set. These are just more tips of the trade. If you have someone in your workforce at your facility who has previous experience managing a respirator program, that person may be a good candidate to start your program, because they're going to already be familiar with a lot of OSHA's requirements. Likewise, if somebody is an experienced respirator user and maybe they've never managed a program, they've certainly been part of a program, even if it's not completely compliant with OSHA's rules. They've been part of a program, and they may have a good understanding of what it takes to run a respirator program simply by having been a respirator user. Next, the employer is going to have to provide the authority to the program administrator to implement the program. So generally speaking, you want the person with authority to be able to manage and control the main aspects, and then of course report to management about the effectiveness and how the program is being implemented. All right, and then the administrator, depending on the complexity of the program, the administrator will need to get up to speed on a number of things through some training. So an appropriate level of training for a given program administrator is really a hard question or a hard single answer to give, but it's based on the complexity of the program. So for instance, if you have a small workforce that's going to be using respirators, the level of appropriate training may be somewhat less or limited compared to a large-scale program with many employees, and therefore a level of training needs to be a little bit greater for higher levels of respiratory protection, different styles of equipment, and so forth. And then once designated as a program administrator, that person should become familiar with the OSHA respiratory standard. It's not a terribly long standard, but it does have some technical aspects that are worthy of reading through and becoming familiar with. All right, next slide, please. All right, and before we get toward the end of my part of the presentation, it's very important that I say this as well, is that employees, as part of being in your workforce, are not subject to having to pay for their own equipment or training or anything to that effect. So it's in an OSHA standard that the employer must provide the respiratory protection equipment, the training, and the medical evaluations at no cost to the employee. And what that truly means is what it says, no cost to the employee. So if you, for instance, send an employee to their doctor for a medical evaluation and you ask them to do that after hours and you don't compensate them for their time, that is at the burden or the cost of the employee. So that would be against OSHA's take on that. So time, money, effort needs to be on company time, and that's essentially what that means. Next slide. All right, so this is basically kind of summarizing some of the things we've talked about. So when selecting respirators and going to begin a respiratory protection program, getting started, this is a reminder that first, OSHA expects employers to look at the hierarchy of controls, provide job hazard analysis, determine the type of hazard that are going to affect the employees, and look at routine uses of respiratory protection equipment, as well as any chance for using that equipment during some kind of emergency. OSHA expects employers to provide a sufficient variety of respiratory protection, as well as consider the comfort and other user factors. And when respirators are required in a workplace setting, OSHA standard says that NIOSH certified respirators must be used. There are other items to be considered, like the work environment, if it's a hot or cold environment, if it's sterile, and then using the resources within the OSHA respirator standard, such as assigned protection factors that help you to determine the level of protection needed to protect employees. So you see a few items there that we've put a little star next to, and that represents some of the challenges during this current pandemic, national emergency, challenges that employers may face in obtaining or using a certain respiratory protection equipment. And that is a discussion that will be undertaken yet in this presentation. So with that, I'm going to go ahead and turn things over to Dr. Bonnie Rogers. Bonnie?
Listening to your presentation, that was very informative, so thank you for that. Oops. I enjoyed listening to your presentation, so that was very informative. Thank you very much. I think we're a little bit on time, so I'm going to talk about these competencies briefly and refer to some of the issues that Tim covered as well, so that we're not going to repeat things. Next slide, please. So when you look at healthcare workers who are at risk, there are about 18 million healthcare workers in the US. And what's important here when we speak about long-term care is about a quarter of those, nearly 25%, are working in nursing homes, long-term care settings, or residential facilities where you have the aggregate group of residents that really, when we talk about COVID or influenza, are simply at great risk. And then of course you have your healthcare workers also working in those environments where the exposure is pretty significant. Next slide, please. The respiratory protection related to personal protective equipment. I'm not going to spend time on this as Tim covered all of this, most of this, but just to note that you have your surgical masks. And the interesting part here is, and I think Tim mentioned this too, is that the surgical masks really are meant to protect others from you. So, and in the studies that have been done, what we see is that aerosol particle penetration, it really is a wide range from 4% to 90%. So you can see that the protection factor is great here in terms of being so wide in the range. It's very variable. And the problem here, of course, is that the surgical masks are open on the sides, the top and the bottom. So that's why the penetration can easily occur. Then you have your respirators, which Tim talked about, your filtering facepiece respirators, commonly called your N95s, that can filter out the relevant particles. Of course, those cover the mouth and the nose pretty tightly, and that's why a fit test is required, which is really critical. And then you have your elastomeric half mask or full mask reusable with replaceable filters, which makes it nice because then you're not constantly using new N95s, disposing of them. But they do require then, of course, cleaning and disinfection. And then you have your PAPRs, which are the powered air purifying respirators, as Tim talked about and showed you pictures of those. And you've seen those yourselves where they fit over your head in terms of the hooded variety, but they're expensive. The personal protective equipment acts as barriers. You got your gloves, your gowns, respirators, eye protection. And the challenges with those, of course, are it's very difficult in some ways to communicate, not only with staff, but with patients. So you find yourself repeating things. And oftentimes you'll find yourself pulling the respirator down, which of course then defeats the purpose in terms of protection. There's difficulty breathing, and with your gloves, of course, you have the tactile sensitivity can be an issue for you. And of course, they're hot and uncomfortable when you have to wear them hours at a time. Next slide, please. So when we talk about competencies, and I'm just going to spend a little bit of time on this, I won't go into great detail, but you'll see at the top there, I listed here a article related to these competencies. So you can access that article as well. And it goes into great detail on how these competencies were developed. And we did this in North Carolina to research studies in many hospitals, more than 20 hospitals in North Carolina, to look at what kinds of competencies should any healthcare worker have in terms of protection. You know, so we're not just talking about nurses, we're talking about any kind of healthcare worker who has an exposure. So it really relates to any personnel with a respiratory illness exposure. And then for conditions that require airborne precautions, and you'll see these listed as they were were identified by the Centers for Disease Control and Prevention. And in that toolkit that Tim mentioned earlier, there is a figure in there that lists all of these. So you've got your aerosolized spore-containing powders like anthrax, aspergillosis, varicella, zoster, measles, monkeypox, SARS, smallpox, TB, and then any other kind of novel or emerging pathogen for which public health guidelines recommend airborne infection isolation. And we're there with this, with the COVID as a novel pathogen. So you can see all these different kinds of conditions where precautions need to be maintained in terms of recognized use of respiratory protection. Next slide, please. So the second competency is to know the current hospital respiratory protection policy and the schedule for implementation of fit testing and education. Let me just back up one moment to say that these 9 competencies, as you can read in that particular article, were developed from the research studies that we did in North Carolina. And so these really came out of those studies and were rated and by the healthcare workers in those institutions. So know the current hospital respiratory protection policy. The policy really needs to be clear, ready, immediate, and that there is access to those policies 24/7. You know, and the issue too with policies and also with fit testing, any kind of training that you do, as you have shifts and shift workers, of course it becomes an issue to make sure that all workers on these variety of shifts, you know, are getting protection. So that's always a challenge. The semi-annual review with healthcare worker input, this is really critical, particularly when there's any policy change or there's evidence of non-effectiveness or lack of compliance with respiratory protection. But the point here is that these policies need to have input from the frontline workers so that everybody has the correct respiratory protection that will actually work for them. And then of course your fit testing and training requirements need to be identified in the policies and when those are to be done. What is the frequency? So fit testing should be done annually, certainly the training as well, but you may want to have that more often. And again, talking about shifts, when will you provide that in terms of those workers who are on shifts? Third is describe what aerosol and droplet transmission means and what's the health impact from any kind of exposure to both the worker and others if the proper protection is not used. And while we think people understand this, it's not always clear. You know, and as we have been faced with the COVID, as we've seen over the last 3 to 4 months, different kinds of recommendations come out depending on what the transmission is. So, you know, more recently was the letter that was sent to the CDC that was signed off by, I don't know what they said, 200 professionals, saying that COVID was not just a droplet exposure, but some studies are showing, of course, that it's an airborne exposure. And the difference, of course, between the airborne and the droplet exposure is the size of the particle. So the airborne particles stay in the air. That's why they're called airborne. They stay there longer. They're smaller, so they can get in easier. The droplet exposure is a larger particle. Because it's larger, it's heavier. So that's why it drops and it's called droplet. So, but both of those kinds of exposures are really important for people to understand the distinction between them. And then what is the morbidity and mortality related to whatever the pathogen is, whether it's the coronavirus, the flu, whatever the pathogen is that you're trying to provide protection for, know what the signs and symptoms are in terms of morbidity, and then of course the mortality in terms of mortality rates in terms of the different kinds of exposures can be dramatic. So we know that with SARS, of course, and you know, the mortality rates were greater certainly than with the flu, but the flu itself you know, has a mortality rate ranging anywhere from 35 to 70,000 people, at least in the United States, depending on the year. and the exposure and other kinds of factors. Now, related to that, of course, is vaccine and whether or not people get vaccine. And that would be the protective device that would be important. But we know that only about 45, I think less than 50% of people get flu vaccine. Now, when the vaccine comes out for COVID, of course, there's a lot of studies out there that are showing some, who's going to get the vaccine, who's willing to do it. So that becomes a big issue in terms of looking at morbidity and mortality. Next slide, please. So the fourth competency, know what to do if a respiratory exposure occurs and who do you contact. This is very, very important. So if that exposure occurs, what do you do? An exposure incident report to the manager and your designated individual at your work site. Got to know who those people are so that the report can be made and whatever strategies need to be put in place in terms of prevention and control are implemented. Notify infection control and occupational health. Not every institution, of course, has occupational health. But if you do, that's important that those folks be notified. And if any medical intervention is needed, know what's going to happen if an exposure occurs. The fifth competency, describe when a respirator should be used, the consequences of not wearing a specific fit-tested model and size. That's why fit testing is so important, because the respirators come in different sizes and will fit the face differently. So you got your small, your medium, your large. You certainly don't want somebody with a small face probably wearing a large respirator. It's not going to work for them. So that's why the fit testing becomes so important. Respirators are used in high hazard procedures like sputum induction, suctioning, giving certain kinds of medication. Whenever you enter an isolation area or a location where airborne infectious diseases could be present, transporting patients within a facility or certainly within an enclosed vehicle. Again, it's important, and that happens a lot, particularly if you're moving a patient from the long-term care facility to a hospital. And then with annual fit test, or if there's a physical change that would alter the fit for the worker, like if you've lost a lot of weight, then the fit of the respirator may not be there. So that's important to know that. The next competency, number 6, is demonstrating donning, doffing, and seal check of respirators using proper strap placement. Important here is that people who are using respirators need to know how to properly put it on, take it off, and that they know how to do a seal check once the respirator is on the face. And a lot of people don't do that. So that's important to know how to do that seal check every time you put that respirator on, that it's actually working for you. You got to inspect the respirator for use, that it's not been damaged. That somebody hasn't spilled coffee on it or whatever. So inspect that to make sure it's going to work for you, and that the proper procedures in terms of donning and doffing are used, particularly with other PPE, like when do you take it off, with the use of gloves and gowns and eye protection. So all of those things are important. The next slide, please. Competency 7, know methods of care, storage, maintenance for the respirator, and then how they should be disposed of, particularly your N95s, because those are going to be disposed of. Where are they stored? Who maintains them? And it's good to have a log check for storage and use and care, so that people are actually signing off when they have, if they're caring for like an elastomeric or a PAPR, that those are marked as to who actually did any kind of cleaning and care, and that the N95 face filter respirator is disposed of after each use. Prevention and control with respiratory hygiene, we're familiar with that. Hand hygiene is, we know, critical. And with the COVID, of course, we're supposed to be washing our hands for 20 seconds every time there's been even a thought of an exposure. So even when I come home, every time I come into the house, of course, I wash my hands. So hand hygiene is very, very critical. Cover a cough, you know how to do that. Maintaining that social distance of at least 6 feet, and that waste disposal is taken care of. So if you're coughing and you're coughing into a tissue, that waste doesn't go back into your pocket. You know, it goes into the waste disposal system that you have in place there. Competency 8, and I think this one is really critical. Be accountable for respiratory health protection as a result of any kind of exposure. That means all of us are accountable. It's not just management. It's not just the healthcare worker. Everybody has to be responsible for knowing what to do and how to do it. So we have the contact precautions, use of PPE, and making sure that patient equipment is dedicated to that patient. Droplet precautions, as we've talked about, airborne precautions with isolation and N95s, and that everyone is responsible, management and staff, that there are tracking systems in place and monitored. And so if somebody is positive for COVID, tracking systems need to be in place in terms of contact tracing, for example, and if there's any self-quarantine going on, that needs to be monitored, and that everybody is responsible in terms of prevention and compliance, as we have talked about. Next slide, please. And then the final competency, identifying internal and external resources. And I think Megan's going to talk much more about this in terms of information on respiratory protection, but there are lots of sources out there. You've got, of course, OSHA, NIOSH, CDC, the National Personal Protective Technology Laboratory, of course, which does all the work with respirators. And then be very familiar with your own institutional policies and training resources. Now, one caveat here when we look at resources, which I find concerning, is that when you go onto these websites, that there are so many resources there, it's overwhelming. And hopefully that can be dealt with, but that to me is an issue. Particularly if you're not sure which resource to look for, but just know that that happens, and there are many links on these pages, and you got to be patient. Next slide, please. The challenges and issues that we face, just looking at the time here, have a complete and regular policy review with healthcare worker input. That's very, very important. Making sure that the training is appropriate, particularly related to donning, doffing, get those seal checks done, and really, I would suggest monitoring people on how they're doing seal checks, have them do return demonstrations, have a better understanding of transmission with pathogens, do regular observation and monitoring of staff as they're working to see that they're doing things in a proper and compliant way. Know that communication with patients and staff is a challenge, and it's probably always going to be a challenge when you're wearing a respirator. Address other respiratory hazards, tobacco cessation. So smoking, of course, we know is always an issue with everything related to health. And as you're wearing a respirator, of course, that's not going to be a good thing as well. And then, as Tim mentioned, program effectiveness evaluation is important in the respiratory protection standard. But as we've done these studies with respiratory protection, this is the one that's the least looked at. So program evaluation needs to be done systematically and all the time. It's not just a one-time, one-year thing. It should be looked at on a regular basis and have your healthcare workers clearly involved with evaluation. Next slide, please. Now here, and I think Tim mentioned with the hierarchy of controls, I'm not going to go through this, but go on to the NIOSH website and you'll see the hierarchy of controls. But the point here, when you see elimination and substitution, that's where we're starting. Elimination and substitution, and then engineering controls, isolating people from the hazard. Followed by your administrative control, changing the way that people work, and then lastly, use of PPE. But with respirators, that's very, very critical, that people use the respirators in the way that's meant to be done. And then finally, the last slide, when we look at, next slide, please. hierarchy of prevention and control. I put that word in there. The engineering, that you have good ventilation. I think every time that you can be outside breathing the fresh air is great. So having breaks where people can actually go outside and breathe fresh air is good. But of course, we're talking about ventilation within the institution itself has to be good. Isolation and barriers, making sure that people are looking at those in terms of prevention and compliance. And then your administrative work practice controls, minimize the exposure in general and during transport, that respirators that are meant to be cleaned, disinfected, are actually done, and those that are meant to be disposed of, like your N95s, are actually disposed of properly. Training, respiratory hygiene, and as I mentioned before, vaccine, when that becomes available for COVID, everybody should look at that, and people should be encouraged to get vaccine when they can. And then lastly, of course, your PPE with your respirator, goggles, gowns, and gloves, and that all of these types of equipment are properly fitted, worn, maintained, and disposed of. So that really concludes what I have to say about that. So I'm going to turn this over to Megan Casey now. Thank you very much.
Great, thanks so much, Bonnie. So today I'm going to tell you a little more about some respiratory protection resources that might be helpful to long-term care facilities as they go about developing and planning their respiratory protection program. Next slide. The information that I'm presenting today comes from the Centers for Disease Control and Prevention's National Personal Protective Technology Laboratory, or NPPTL. NPPTL is part of the National Institute for Occupational Safety and Health, or NIOSH. Next slide. The National Personal Protective Technology Laboratory is the federal entity responsible for approving respirators for use in U.S. workplaces. You may notice the NIOSH logo on an N95 or other respirator. In addition to approving respirators, we also develop guidance, standards, test methods, and also conduct research on all types of personal protective equipment. We also develop educational and training information to help healthcare facilities and other workplaces administer and use PPE appropriately. Next slide. So again, today, I'm just going to highlight some of our NPPTL resources for respiratory protection. Next slide. The first resource that I want to point you to is our webpage that's dedicated to healthcare respiratory protection resources. This page provides a gateway to a number of additional pages that are focused on various respiratory protection topics. So you can see here we have information on policies and procedures, information that might be specific to your respiratory protection program administrator, and also evaluation and selection of respirators, along with other information. Next slide. So here, if you click on the Policies and Procedures tab, you'll then find links to NIOSH documents, infographics, blogs, journal articles, and links to other guidance documents. And I'll tell you a little bit more about each of these resources. Next slide. So NPPTL has a number of helpful infographics that might be useful to long-term care facilities, and here I'll just highlight a few. So on the far left, you'll see our Understanding the Difference infographic. So this explains the differences between medical masks and N95 respirators. The middle infographic explains what the N in N95 means, along with other respirator designations that might be helpful to you when selecting respirators. The infographic on the far left explains why annual respirator fit testing is important, and some of our NIOSH research regarding fit testing. All of these infographics are available at the website that's shown, along with many more. Next slide. Now, one of our most popular infographics has to do with facial hair. As many of you know, tight-fitting filtering facepiece respirators, such as N95s, cannot make a tight seal against your face unless you're clean shaven. However, there are a few facial hairstyles that are compatible with an N95 respirator. You and your staff might find this infographic not only helpful, but maybe also a little humorous. Next slide. This is another infographic that explains how to correctly put on a filtering facepiece respirator, such as an N95, and explains that the only way for a respirator to be effective is to wear and use it properly. Next slide. In addition to our infographics, we have many fact sheets available. Here I'm highlighting our Filtering Out Confusion fact sheet series. And this addresses some of the most commonly asked questions regarding respirator use in the workplace. This includes issues around reuse and extended use of respirators, fit testing, and how to conduct a user seal check. Next slide. NPPTL also writes many blogs to explain or highlight some of our research findings. These blogs provide short, plain language and actionable summaries of our NPPTL research. Here I'm highlighting two blogs that summarize our work regarding covering N95 respirators with surgical masks if your facility is practicing the reuse of respirators. There's also a blog on the physiological impacts of wearing a respirator for long periods of time if your facility is currently implementing the extended use of respirators. Next slide. One of the blogs we've written explains why it's necessary for facilities to conduct annual fit testing. Our NPPTL scientists followed 229 subjects for 3 years and measured their faces every 6 months. What they found was that the dimensions of our faces can actually change significantly, even over short periods of time. And this is why regular annual respirator fit testing is necessary and important. Next slide. So again, please visit our Healthcare Respiratory Protection Resources webpage to find links to this information and more. Next slide. So now I'm going to transition to some of our NPPTL resources to help you select and purchase respirators for your facility. Next slide. So as I mentioned before, NPPTL is the federal entity that approves respirators for use in U.S. workplaces. And you can tell that your respirator is approved by NIOSH by looking for specific markings noted here, including the approval number, the NIOSH logo, as well as the model number and the lot number. Next slide. So to help you find respirators that have been approved by NIOSH, we have the NIOSH Certified Equipment List, or the CEL. This tool is regularly updated to include respirators that are newly approved or remove respirators that are obsolete. Next slide. And here's a picture of our CEL, and you can search for NIOSH approved respirators using various criteria, again, such as the approval number or the manufacturer or the type of respirator that you're looking for. Next slide. And the CEL will provide you search results such as these, providing you the manufacturer, the model number, and also the type of respirator. Next slide. Now, we are aware, especially now during COVID-19, that there are a number of respirators on the market that claim to have NIOSH approval, but are not actually approved. We encourage you to take a look at our counterfeit respirator webpage, which will list respirators that have been determined to be counterfeit. Next slide. Now, I'd like to point to a few specific resources for long-term care facilities during COVID-19. Next slide. As many of you know, COVID-19 has put tremendous strain on our personal protective equipment supply chains, and in many cases, PPE can be hard to find. Recognizing these shortages, CDC has put together strategies for optimizing PPE. These strategies provide options for healthcare facilities when personal protective equipment supplies are running low or have been depleted. Next slide. Now, if you're unable to obtain a NIOSH-approved respirator, one of CDC's PPE optimization crisis strategies is to purchase a respirator that is not NIOSH-approved, but conforms to an international standard. The CDC guidelines specify international standards that are nearly equivalent to NIOSH-approved N95s. It's important to remember that respirator manufacturers that are NIOSH approval holders also often manufacture respirators according to these international standards. So if the respirator you are purchasing has been approved to an international standard, you can have confidence in that respirator if you're purchasing from a manufacturer who is also a NIOSH approval holder. And again, you can look at our certified equipment list to see a list of our manufacturers who are NIOSH approval holders. Next slide. Now, it's important to remember that purchasing non-NIOSH approved respirators is a crisis strategy, only to be implemented when all other strategies have been considered or implemented. If you're responsible for selecting and purchasing respirators at your facility, please take a look at these resources before purchasing non-NIOSH approved respirators that have been made internationally. These resources provide you tips and best practices to determine if you're making a good respirator purchase. Next slide. During COVID-19, NPPTL has become aware of not only counterfeit respirators on the market, but also respirators that do not provide the protection that they're advertising. Since the beginning of April 2020, NPPTL has tested over 281 different international respirator models. Based on these assessments, we found that the majority provide less than expected protection. That is, they provide less than 95% filtration. Now, these results are posted on our NPPTL webpage. So again, if you are responsible for purchasing respirators for your facility and you have no other choice than to purchase respirators that are not NIOSH approved and made internationally, please visit this website to make sure that they provide the expected level of protection. Next slide. Now, NIOSH has been working with the Food and Drug Administration to help verify and validate many of the respirators that are on the market. The FDA's emergency use authorization provides a list of respirators that are not NIOSH approved, but have been vetted for use in healthcare. And again, please take a look at our resources for purchasing international respirators that are not NIOSH approved. Next slide. Thank you for your time.
So this is Marie DePirio. This will conclude the presentation part of our webinar. Thank you so much to our speakers for some really great information. So we've compiled some frequently asked questions that we fielded from both nursing home administrators and also employees that we'd like to pose to our speakers for their responses. So I think I'll pose the first question to Tim Gackle from OSHA. So when selecting a program administrator, what do you suggest if there isn't anyone that has experience in managing such a program or has experience with respirators?
All right, that's a great question. And so my answer to that would be, without previous experience, there are some qualities you might use to choose an appropriate program administrator. So it could include someone with work experience in your facility or institution, since a current employee already will be familiar with how your workplace functions and likely has developed good working relationships with others in the same environment. So the point here is that a brand new employee might not be the best choice because they're less likely to possess some of these qualities. Another quality that is favorable is someone with some management potential and someone with critical decision-making capability. They might be the appropriate choice. What this does is it provides a framework for an authority chain to develop and keep good working relationships from management down through lower level employees. One other tip I will give here is that this does not have to be done alone. Although the administrator needs to be chosen as the overall authority to run the program, parts of a program can be disseminated or broken up to other people. So taking more of a team approach, so to speak. So aspects like fit testing, medical evaluation, arranging for those examinations or doctor's visits can be broken up into manageable pieces. And so that may work for many facilities that are wondering how much load to put on one person. So that's the way I would answer that question.
Great, thank you. I think those are some really helpful tips. The next question I'll pose to Bonnie. Can you talk about some of the common mistakes that you have seen with healthcare personnel wearing respirators incorrectly?
Yes. So in the research that we've done, when people, I think probably as I mentioned in the presentation, being certain that you know actually how to don and doff respirators. This is very common issues related to this. How do you put the respirator on properly? Where do the straps actually go? What strap goes on first? And then the seal check. So the seal check is often not even done. So once people put the respirator on, it's really critical that you go back and do the seal check to make sure that air is not filtering into your breathing zone. Otherwise, there's no really point to wear the respirator. So that's really very critical. Other issues are with men who have beards. Now, if you have a beard or something close to a beard, then the respirator will not fit properly. So some of what we found in our studies is that men will shave when they go to get the fit test done, but then grow back the beard. So that's not a good thing to do because then the respirator won't fit, period. So those are some of the common issues I think that occur. And of course, if you have any changes in your physical appearance, as I mentioned, if you've lost weight, then you need to go back and have that fit test redone to make sure that the respirator is going to fit you properly as you move forward. So those are some of the really important issues, I think.
Great, thank you. This question is for Megan. So I've heard that some nursing homes are having trouble obtaining N95 respirators for their employees, but that some nursing homes are able to obtain respirators that are past their intended shelf life. So can you talk more about the use of these so-called expired respirators in healthcare settings?
Sure. So in times of shortage, consideration can be made to use N95 respirators that are beyond the manufacturer designated shelf life. However, expired respirators might not perform to the requirements for which they were certified. So over time, components like the strap or the material might degrade, and that can affect the quality of the fit and the seal. Now, NPPTL has done some research and found that many models that were found in US stockpiles and stockpiles of healthcare facilities have been determined to actually continue to perform in accordance with our performance standards. But again, it's always optimal to use these respirators in the context of a respiratory protection program. And so, you need to still be medically evaluated, trained, and fit tested in order to use these respirators that are beyond the manufacturer's shelf life.
Thank you, Megan. Now I'm going to pose a question to Tim. So this is a question we get a lot at CDC. So why is a medical evaluation required to wear a respirator?
Well, we at OSHA get that question quite a bit as well. And the reason that a medical evaluation is required is it's very important to assess the health of your employees prior to asking them or requiring them to use a respirator, as the placement of a respirator over the nose and mouth, over your respiratory system, does place a certain amount of burden on the respiratory tract. It makes it more difficult as you've got now a barrier between free airflow and your lungs, and so some people cannot actually medically tolerate the use of a respirator, and so it's very important that a physician or other licensed healthcare practitioner who is licensed in the area for which they practice to provide a medical evaluation for those respirator uses. And that simply starts with the questionnaire in Appendix C of OSHA's Respiratory Protection Standard.
Great, thank you. And I think we have time for one more question before we conclude, and I'll pose this to Bonnie. So we've heard that having practice champions or employees who serve as advocates or leaders for implementation of specific practices could be useful for implementing respiratory protection programs in healthcare facilities. Can you tell us a little bit more about these practice champions?
Yes, I would highly recommend that. So in the studies that we did, we had practice champions that were identified by hospitals, and these were actually these were nurses who worked on the units who were interested in being a practice champion in respiratory protection. So they became knowledgeable about respiratory protection and served to be a resource actually on the unit where other healthcare workers were working, and provided guidance and resources to people who were actually delivering the care that had questions about respiratory protection. Or they also observed and monitored healthcare workers as they put on a respirator, or as they were working with a respirator, or doffing the respirator to make sure that that was being done properly. And even when the research concluded, the study concluded, the hospitals, several of the hospitals kept the practice champions because they were so valuable. They were able also to refer healthcare workers who needed to be refit tested. So they went back down to occupational health and got a refit on their respirator, so it was a better fit for them. So they really served a great purposes. These practice champions, I believe, I'm trying to recall here, but they did this practice champion piece for no more than 2 months. And in the hospitals, let me think here, I think there were 6 hospitals, and well over 250 referrals were made just during that period of time. In terms of infection, referring people back to infection control, referring them to occupational health, or having in-service training. So they would have group meetings as well about respiratory protection, any kinds of the issues that were raised in terms of prevention and compliance. So they did a great service, and I would highly recommend those, because it then provides the institution with a person that other people can go to, not feel threatened by, so there wasn't any punitive stuff going on. It was all really just meant to be advocacy, education, those kinds of things, making certain that people were practicing in the way that provided absolute, really protection for them.
Thanks, Bonnie.
Could I actually add on to that? It's just very quick.
Sure.
Yeah, so what Bonnie just talked about, I feel is an excellent example of something that I mentioned, and that is you don't have to do this program alone. There are great ways to do training, fit testing, medical evaluation, and Bonnie's description of those practice champions is a great example of how this can be done, this can be managed, and can make your respiratory protection program effective. And I just think that's a great example.
Thanks.
Yeah, and let me just mention too, in that article that I mentioned that was on my slides, there's a whole description of the practice champions in there. So you might find that useful as well.
Thank you to both of you. So this concludes our webinar. We thank all 3 of our speakers for all of the valuable information that they have shared. And I want to encourage anyone watching this to access, the resources that our speakers have presented. So thanks again for everyone tuning in, and have a good day.
Thank you very much.